Anybody who's has that type of hypermobility in their joints where they're super flexible, I would highly recommend getting adjusted, because certain joints are going to be or more restricted and lead to a buildup of arthritis. Hey guys, Dr. Randy, Kalkstein Chiropractic. Got Jeff in the office. Jeff's a veteran coming in. We do see a lot of veterans in the office, so but that's not why I wanted to shoot the video with him. He's been a patient for a while. We got to give him a full spine adjustment. We might even do some traction on him. We'll see. His chief complaint today is upper back, neck pain. He sometimes gets some anterior shoulder pain. We'll show you how we treat that. And you said low back, Jeff?
Yes.
What else?
Is that it? Yeah, that right SI joint.
Right SI joint. So he's having a little bit of everything. He gets headaches. Like I said, the shoulder pain. So let's get into it. Do you want some the flexion distraction technique or no? Do you like that?
Sure.
Okay. We've done this in a lot of the videos. We're going to do a quick flexion distraction. It's really good for SI, low back pain. And that's where we kind of strap the patient here. And we'll just do a nice little light. Now the thing with Jeff is he has this connective tissue. Let's put a little lighter setting there. First of all, this is a great stretch for low back pain. It's a great treatment for hip, low back pain, sciatic pain. Because not only is it stretched this way, it also pulls some flexion. People who are on their feet too much, we naturally have this curve in our low back here. And if you're on your feet or at a desk too much, that low back sort of compresses. This helps stretch it into flexion and distraction. And with this table, I can unlock it and kind of take it side to side. So it really can isolate. For instance, he's having right SI pain right here, which is a very common spot, which is right where his lumbar spine comes down, his sacrum sits here, then his two iliums sit here where my hands are. Where my thumb is his SI joint. Inflammation builds up around it because of hip misalignment and restriction, which we can talk about. But this technique with a little bit of lateral pull here really gets the SI. You okay, Jeff?
Yep.
We'll just do a couple passes. I may do more of this, but this is the gist of this technique. Really good for low back. I was saying Jeff has a connective tissue issue where he's almost has ligamentous laxity. Ligamentous laxity is something that happens with pregnant women. One of the issues why people should get it through pregnancy. But it can happen to anybody. So instead of his joints being too almost restricted when he was younger, they were too loose. Almost that people call double jointed. It's not double jointed, is that their ligaments don't have a tensile strength to them, and they can just kind of bend their thumb back in weird positions. What it does is it makes your joints sort of unstable, and you can develop arthritis in certain joints that are because of the instability. So getting adjusted would be, he's to the point now where he is, instead of being hypermobile, that hypermobility has turned to arthritis in a lot of his joints and has led to a lot of problems for him, which we're working on. But anybody who's has that type of hypermobility in their joints where they're super flexible, I would highly recommend getting adjusted, because certain joints are going to be or more restricted and lead to a buildup of arthritis. So back to his SI, we're just going to strip down his right SI. We try to do a little soft tissue on every patient. This is his QL, his right QL muscle. That's going to be involved. This muscle attaches to the transverse process of his lumbar spine all the way down to his right ilium here. He's tender. You can see him kicking. He has a lot of inflammation buildup. Again, people who, especially now that we're working from home, if you're at home, you're working at a desk too much, don't just ignore the pain or take something to cover it up. Get in and get adjusted. Let us fix those misalignments in your spine. Just get to the root cause so you don't end up with a bigger problem down the road. We do a lot of drop work here. Anybody that doesn't tolerate a twisting sort of side posture adjustment, you can just get drop work. We have a lot of patients who come with low back pain who just get soft tissue work and drop work, and they get a lot of relief with that treatment. Now, Jeff, we're going to put him on his side real easy at the end, but you don't have to go on your side. Anybody who's had that adjustment before may not like it. Some people may not like it. Yeah, just stripping his low back down, so gentle pressure, flushing out inflammation. Now, he should ice this later so this inflammation doesn't kick up and cause more swelling. So he got his hips nice, moving loose. Check his leg length. He's still a little short there on his right. Again, that's where that right SI pain is coming from. Pull your back, Jeff. Cross his arms. So he moves side down. This is the adjustment for his low back, his mid back pain. Relax, come back on my hand here. Deep breath. Blow it out. Good. Nice. Good. Last one. There it is. Come down even a little further. Like I said, he gets a lot of anterior chest pain. So it's SC, sternoclavicular joint, and even out here where it articulates with his acromion. So we're going to just kind of give him a nice light drop. Good. And even on his sternum here. Hang on to the table to the hips while I'm down here. Like I said in the beginning, we kind of do a little bit of everything on him. That's kind of why I want. Same thing here. Just contacting his sternoclavicular joint right through here. Some people who get costochondritis and have sternum, like anterior chest pain, this is really good for that. Just kind of setting the drop and giving a nice, very light pressure. Then we'll get out here, the distal part of the clavicle where it articulates with his humerus, and again, just give a very light pressure. Okay, now I'm going to adjust his neck real light. Just relax your shoulders, Jeffrey. Good, come on up. Good, and this way. There it is, perfect. Kind of the full works here, a little light. Pick it up. Distraction, let your head drop. Good for headaches, neck pain. What else are we doing today? Shoulders, on your side?
On the side, hips.
On your side, please, to me. Chest good on top. Take a nice deep breath in. Exhale, just real light. He moved pretty good. Face down with the drop work and soft tissue, but we'll just make sure with the side posture adjustment. Same thing, deep breath. Exhale. Good. What else, shoulders? Yeah. Come on up. Knees, good.
You can do anything with the left knee. The right knee's the replacement ones.
Oh yeah.
Yeah.
Just a nice light knee mobilization here. There we go. That's basically it. I may do a little more of that traction on him, any more soft tissue, but that's his general treatment in the office. We kind of hit a little bit of everything. So, thanks for watching.